Good day, everyone. I am Erica M. Agustino, and I am here with my groupmates Bench R. Bileron and Jamil Puada, who will present research article review about basics of cytology. Basics of cytology. This overview is intended to give a general outline of the basics of cytopathology. This field is gaining tremendous momentum worldwide due to its speed, accuracy, and cost-effectiveness. This review will include a brief description of cytology history from its inception, followed by recent developments. Discussion about the different types of specimens, whether exfoliated or aspiration, will be presented with an explanation of its role as a screening and diagnostic test. A brief description of the indications, utilizations, sensitivity, specificity, specificity, cost-effectiveness, speed, and accuracy will be carried out. Introduction to cytology. The art and science of cytology and cytopathology have been implemented and recognized as early as the 18th and 19th centuries. However, the progress and the standardization of this branch of pathology were not entirely founded until the late 20th century. The first American Board of Examination in cytopathology was undertaken in 1989. Europeans, especially North Scandinavian countries, could utilize this technique even before World War II. The science of cytopathology is currently well standardized with two significant branches, which is exfoliative and aspiration biopsy. The After whom the famous Papa Nicolau or Pap smear and Pap stain were named, George Papa Nicolau was one of the initial pioneers. They drove the attention to the science of making a diagnosis by looking at slides with a smear of cells between 1917 and 1928. Doctors published the initial North American scientific papers describing tumor diagnosis by cytological examination in 1930 from New York Memorial Hospital. Martin and Ellis followed by the publication by Dr. Stewart in 1933. After this, the scientific and medical community started paying attention and aggressively pursuing this subspecialized field of pathology. The first examination of American Board of Cytopathology was held in 1989 after the standardization of this branch of pathology. Currently, a one-year cytopathology fellowship in an accredited program is needed to be eligible for this exam. In addition, the Accreditation Council of Graduate Medical Education or ACGME, the agency that accredits residency training programs in pathology in the United States of America, currently mandated documentation of fine needle aspiration FNA, performance training for both residents and cytopathology fellows. Next presenter is Bench R. Bileron.
Utilization of cytopathology. The following are the ultimate objectives from utilization of most cytological specimen and wide range of diagnostic categories. The optimum goal is to reach a definitive diagnosis. The objective is to ultimate goal. Clinician, patients, and pathologists are all interested in reaching a definitive specific diagnosis utilizing a single diagnostic test. It is well recognized that the utilization of different cytological examination from different organs provided sufficient diagnosis information that drives treatment decisions. As a screening tool, the success story of the utilizing Papa Nicolai smears to detect early precursor cervical cancer lesson is well known in the development world. Rates of cancer death due to cervical cancer drop tremendously after the 1990s when the Papa Nicolai smears screening program had started. As a follow-up for different diseases, cytological experiments of specimens taken from different sites after establishing the initial diagnostic is a routine procedure, sputum broncholar velar. For the determination of different prognostic factors in a neoplasm diagnosis, this is usually achieved as part of staging or cytological samples to perform ancillary studies, as HER2 analysis on breast mass aspirates. Next slide, please. Figure 1% um, core image of different smears. Sample A, aspirate smear of a inigual lymph node showing poorly formed negloma with neutrophils. Combining the cytology and serological result, the diagnosis of cat scratch disease was made. Sample B, broncholar velar, a lavage specimen with strongyloid in a immunocompromised patient. Sample C, scrape cytology smear of a non-healing ulcer of hand of a patient with acute myeloid leukemia. The smear shows fungal hyphae of mucous species. And sample D, bronchial velar lavage, specimen showing that characteristics flappy cluster of pneumocystic gervasi in a patient with AIDS. Next slide, please. Figure 2 shows four different smears. Sample A, low power view of a unsprayed uh, smear of a solitary liver mass in a patient with a chronic history of hepatitis C, showing the development of hepatocellular carcinoma. And the sample B, high power view of metastatic small cell carcinoma to adrenal gland from the lung primary. The diagnosis made through computer thermographic guided fine needle aspiration. And sample C, pleural fluid cytology from a patient with ovarian adenocarcinoma showing the characteristic metastasis. Sample D, pleural fluid cytology from a patient with pleural-based mass diagnosed with mesothelioma. Characteristic aminohistochemical stains confirm that the diagnosis of pleural fluid material. Next slide, please. Figure 3 shows flow cytometry dot plot image from a submetal lymph node. The panels of the left side are from the FNA material using a CRAT method, and the panels of the right are from the same patient of the node was excised surgically. Both panels are identical, demonstrating that the efficient of the CRAT method. Next slide, please. Figure 4, figure 4 shows a case of Hodgkin's lymphoma that FNA diagnosed. A and B showing the cell block of the cell that case that contains a few ridge Sternberg cells. The cells were immunoreactive to CD15 and CD30 and negative for CD45 and 20. confirming that diagnosis. And the next presenter is Jamil Wada.
Advantages of using cytology. Next slide, please. Advantages of utilizing cytological examination over traditional tissue are well known, the most important of which are safe. The procedures that are used to get cytological sample are incredibly safe. Complications are infrequent, and when they occur, they are relatively mild. Hematomas and pneumothoraces are among those. The most severe complication that may occur and be reported is the development of pneumothorax during FNA of lung lesions. However, less than 5% of those are severe and require chest tube insertion. Simple. It is well known that getting most cytological sample is straightforward. With increasing familiarity with different sampling techniques, almost all institutions and healthcare providers are aware of the technology, which is part of routine investigative and diagnostic patient workup. Description of different types of sample will follow. Quick. The procedure is rapid and diagnostic answer can be provided immediately at the procedure time, if needed, or within 24 to 48 hours. Next is cost-effective. The cost-effectiveness of cytological examination is well documented in the literature. It feature that is becoming very critical given the current high healthcare costs compared to surgical biopsies. The amount of saving is substantial. Next slide, please. Branches of cytopathology. Exfoliative cytology. The sample represents cells exfoliating from superficial or deep serosal or mucosal surfaces. This includes gynecological samples. Papa Nicolau smear are the first samples that started the exponential revolution of the cytopathology field. Recently, almost all healthcare providers are moving away from the conventional Papa Nicolau smear and moving to fluid-based technology that can provide more accurate interpretation and allow more molecular testing from human papillomavirus infection. Respiratory exfoliative cytology includes bronchial washing, sputum, bronchoalveolar lavage, and bronchial brushing cytology. Those are commonly used to detect pulmonary infection and malignancies. Next is urinary cytology. Urine cytology, bladder washing, and brushing cytology. The urinary cytology field has been passing through tremendous research recently. So in addition to the cytomorphological examination, the utilization of urine samples to detect common chromosome aberration in urothelial neoplasm has been refined. Commercial kits utilizing the fluorescent in situ hybridization are already available in use. Next is body fluid cytology. Common samples include pleural fluid, pericardial fluid, peritoneal fluid, and cerebrospinal fluid cytology. Similar to respiratory samples, those are also used mainly to detect malignancies and infections. Next is gastrointestinal tract. Sampling the mucosa of the gastrointestinal tract is becoming a routine procedure during endoscopy. Brushing sample detect viral and fungal infection and neoplasia with its precursor lesions. Next is discharge cytology. Discharge from any anatomic location can be easily examined to investigate infection and malignancies. The most common sample is the breast nipple discharge, used as a screening method for detecting mammary carcinoma. And next is scrape cytology. This technique is straightforward and can be performed by either clinician or pathologist at the bedside or clinic. Detection of infection and cancer cells at any surface can be quick and accurate. Next slide, please. Aspiration cytology. Different names are used to describe this expanding technique. The most famous one are FNA, fine needle aspiration biopsy, and needle aspiration biopsy cytology. All of them mean the same thing, aspiring cellular material using a fine needle to make a diagnosis. This technique has been used from any lesion in body, which includes two major areas. Palpable lesions. Palpable lesion can be targeted by clinician and preferably by an experienced cytopathologist. The advantages of having cytopathologists performing or at least being available to confirm material adequacy are well studied in the literature. Non-palpable lesions. The non-palpable lesions are usually done with the help of image analysis, CT scan guided, ultrasound guided, fluoroscopy guided, and recently endoscopic ultrasound guided fine needle aspiration. And the next presenter is Erica Agustino.
Technical aspect of cytology. As shown from slides 8 to 11, there are different smears, and this section will identify each type and give short description. Cytocentrifuge smears are prepared using cytocentrifuge method. This method concentrates the material and especially advantageous when few cells are present in a large amount of fluid, such as pleural and peritoneal fluids. Centrifuge smears using membrane filters. This method utilizes a paper filter with microscopic force to trap contaminating material. It is becoming obsolete since the slide cellular morphology is usually compromised. The next one is monolayer liquid-based cytology. This technology is now the standard method used to prepare Papa Nicolau smears. The smears are superior to their conventional counterparts and allow testing for human papilloma virus DNA particles. The cells are laid on the side in a monolayer fashion and the background is clean. The last slides are those prepared using the cell block technique. As described above, those slides are prepared to utilize formalin ticks, FARAP, thin embedded tissue. The availability of such material provides the pathologists with material that can be used to do special necessary stains. Microorganism and immunohistochemical stains are the most commonly used. Utilizing the science of cytopathology, whether exfoliated or FNA, is cost-effective, fast, accurate, and straightforward. With the recent improvements in technical aspect and the appearance of cell block techniques in cytopathology, the old gold standard of mass sub tissue to make an accurate diagnosis is rapidly changing. And this is our reference. That's all for today. Thank you.